Hi friends, I am Dr. B.V. Rao of Busha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the acute abscess. The bacteria enter the tissue, multiply and produce toxins and cause inflammation. The vitality of the tissue is lowered and the area is surrounded by peripheral and painful zone of acute inflammation and is infiltrated with leukocytes and bacteria. Polymorphs contain a prophylactic enzyme, proteolytic enzyme, which causes liquefaction of the surrounding tissues into pus, which contains dead leukocytes and bacteria. The tension in the abscess rises due to the exudation of plasma, and it may spread along the paths of the lesser resistance to the surface of the body or to a hollow viscus where the pus is discharged. Sometimes the resistance of the body is sufficient to kill the bacteria before pus reaches the surface. In that case, the fluid is absorbed and fibrosis may be followed, or cavity remains containing inspissated pus, as in case of breast, when a misplaced attempt has been made to cure an abscess by antibiotics, forming a lump called antibioma. In few cases, as in case of staphylococcal abscess of bone, Brodys abscess, infection remains latent and gives rise to exacerbation of infection consequent to local injury or lowered resistance. Symptoms: malaise. The degree of malaise depends upon the size of the abscess, virulence of the organism, and the tension in the cavity. Pain. The pain is throbbing in nature, and the pain becomes more if the affected part is dependent, like infected finger. Fever with rigors may be present. All the signs of inflammation like swelling, tenderness, loss of function, redness and heat are present. It is first brawny and edematous, followed by softening and fluctuation are seen. In some cases, increasing edema is characteristic of deep pus, as in acute metastasis. If not treated, the abscess tends to point. The skin or membrane covering it gives way, and the contents are discharged with cure of symptoms. Treatment. When there is an indication of an abscess, it can be aborted by antibiotics, rest, and if possible, elevation of the part. Cavalin poultice or ultra shortwave therapy will promote hyperemia. When the pus is suspected, immediately the abscess must be incised and dependent drainage instituted. In regions where the incisions are fraught with danger to important anatomical structures, as in neck and axilla, a modification of Hilton's method is used. It consists of incising the skin and superficial fascia and opening the abscess by thrusting a pair of sinus forceps or a hemostat into the abscess. By separating the blades, a sufficiently large opening can be made to insert, if necessary, a finger in order to convert a loculi into a single cavity, followed by a drainage tube. Pus from the abscess must be cultured to determine the organism causing it, and sensitivity of the organism is known, and treated accordingly. That's all about the acute abscess, and in the next video I will discuss about some other disease. Thank you.